Can you all hear me okay?
Not really.
Not really, okay. Oh. Is that on me or is that on our tech person? I can talk louder.
That's good.
Okay, certainly not everybody likes it when I talk loud, you know what I'm saying? So I'm happy to do a share.
She's so strident.
For those of you who don't know me, my name is Johana Bencomo. I am the Executive Director of New Mexico Safety Over Profit. We are a statewide organization working with directly impacted people who are living with the lifelong consequences of corporate greed. We're working with folks who care about patient safety, who've been harmed in the medical system. We're working with victims and survivors of sexual assault who are still seeking justice. And we're working with workers who have been harmed at work and are having to battle the workers' compensation area in order to have dignity for healing in their work. As we continue to grow the organization, we will continue to expand our work in consumer protections and people who care about protecting the rights of consumers, everyday New Mexicans that are interacting with everyday systems in our state. Beyond that though, I'm a social worker, I'm a community organizing. I've been organizing in southern New Mexico since 2012. I've done work around immigrant rights issues. Immigration to me is not just a political issue I care about, it's a deeply personal issue I care about. I've been working on workers' rights and border rights issues here in southern New Mexico for many, many years. I know this church very, very well, as it was one of our places for meetings when I used to work at Cafe, which I'm sure many of you are familiar with. Anyway, that's enough about me. I want to get to our presentation here today, where I will be talking to you all about private equity and what we are calling the corporate capture of our community. And what is private equity? I think it gets thrown around quite often and in a very wonky, heady way. This is the definition, but we'll sort of strip it down. Private equity describes the investment of equity capital in private companies. Private equity firms purchase ownership stakes in these private companies that are specifically not listed on stock exchange. The hope of these firms is an increase in value of the purchased equity stakes. We've really stripped it down into this buy, strip, flip model. Private equity will buy up a company, take Joanne Fabrics for example. They will cut costs everywhere, they will extract its profit, sell it, flip it for a return. That doesn't always happen. Some with very profitable industries like healthcare, it is cost cutting, it will extract profits wherever it can, and it will maximize returns for their investors. Buy, strip, flip. Today, the private equity model is so pervasive that across the country, they've bought companies that now private equity owns companies employing 13 million workers across the United States. Next slide. Thank you, you're good. Corporate capture, really for me in a very big picture, don't worry, we'll get down to more New Mexico focused conversations, but in a big picture, the corporate capture is a threat to democracy. When corporate capture occurs, it is gaining an outsized influence over public policy, over regulatory agencies, over essential services, and over community decision making. And I'm going to give you an interesting example of corporate capture in a second. This great organization called Demos has done a ton of work on exactly how corporate capture is a threat to democracy. The corporate concentration has grown levels we have not seen since before the Great Depression. Corporations have lobbied to weaken laws and policies governing antitrust, environmental protections. They've lobbied to weaken laws on workers' rights and protections, on health care, and much more, all to further consolidate their power. One of the, honestly, the best examples of corporate capture right now that we can look at is the Trump ballroom. If you haven't looked at, I know you giggle, you're like, great, but seriously, if you haven't looked at how that's being funded, and for what reason, you should. I highly recommend that you do maybe some podcasts and some reading on who is funding the ballroom and for what reasons. And most of it is corporate dollars. And a lot of those corporations are saying, well, we'll give you this in exchange for regulatory changes, in exchange for stopping investigations on our corporations and how we've harmed people. And so that's a very interesting and, very theatrical, let's say, example of corporate capture. But of course, we know corporate capture has a much more sinister and riskier threat on our lives. And when it comes to private equity and essential services, you might be asking yourself, well, why? The reality is that when a service is needed, no matter what, it becomes an attractive for-profit extraction. And healthcare, for example, is a $5 trillion industry in this country. And so as much as it's a $5 trillion industry, it is also a deeply broken industry, and it's also, frankly, a very fragile industry. And private equity has come in and said, we will fix it. Let us fix it. We will provide what you need, healthcare, to not be so fragile anymore. But they're doing this across many industries: housing, childcare, utilities, veterinary care, emergency transportation like ambulance services, behavioral health clinics, nursing homes, particularly one of the most pervasive, detention and incarceration, surveillance technology now and more. All of these services, things we need every single day, utilities, all of us need utilities. Many of our families need childcare. And everybody needs housing, right? Like all of these services are non-negotiables. We are always engaging with these services in our community, and private equity is coming in and buying them up. And it has become clearer and clearer to us at Safety for Profit, but also many of our partners like at Olay, who is doing work around child care centers who are currently being bought out by private equity places. Housing, Center on Land Poverty is doing work around housing and mobile homes here in New Mexico and others across the country. And of course, utilities. You've all seen Blackstone and the corporate capture of utilities across the country. Across the state, but also across the country. The threat to New Mexico. There is a great organization called the Private Equity Stakeholder Project, which I highly recommend you all take a look at if you haven't already. And they've done incredible analysis. They're tracking private equity across the country, and they're doing analysis state by state. In New Mexico, they give a rating for a risk score for how much is your state at risk of corporate capture. New Mexico has a score of 100 out of 100. We're talking about workers and jobs. Healthcare is at a 100% out of 100 risk score. Housing is growing. Public pensions, which is one of the ways in which private equity makes a lot of their money. Thank you. Why New Mexico? I think we all know, who here has done work on the downwinders? I think some of you. But you all know that work, right? We know that New Mexico has a long history of extraction, a long history of extracting and dumping and harming our communities. And like I said earlier, when there is a particularly fragile system, this aggressive financial model can have severe consequences on our community. In New Mexico, we know that as a rural state, we have rural healthcare shortages, we have hospital instability, we have high poverty rates, high rates of uninsured folks, workforce shortages, and workforce opportunities, frankly, all over the state. Limited competition, which if you think about is why this utilities issue has happened across the state. Like there is limited competition happening. And there, like I said, historic extraction. There are also incredible people in our state legislature doing incredible work to try to rein in some of these things. And not only that, to invest in these essential services that everyday New Mexicans need, like childcare, for example, right? But with these public investments come even more interested parties for profit extraction. Healthcare, I think, is honestly a pretty key case study when it comes to corporate consolidation, corporate capture. Across the country, we have seen this happening. This is not just a New Mexico problem. Private equity is growing in ownership across the country. There's growth of corporate staffing companies, consolidation of physician practices, and hospital mergers all over the country. And because this is, again, so pervasive and it is happening so quickly, there has been a counter to what this can look like. There was a congressional investigation on the impact of private equity, which I'm pretty sure Senator Heinrich was a part of, that named concerns on transparency, consolidation, staffing reductions, and potential impacts on patient care because of private equity. There was a Harvard Medical School-led study that found patients were more likely to experience safety and quality issues after hospitals were acquired by private equity firms. Johns Hopkins University researchers and health policy experts have raised concerns about the growing the corporatization of healthcare. And the Journal of the American Medical Association has also put out reports that private equity acquisition was associated with increased hospital-acquired adverse events, falls, diseases, infections, things like that. And many of you know the healthcare reality that we have in the state. So right now, New Mexico has the highest proportion of private equity-owned hospitals in the country. New Mexico is also among the top 10 states for both the share of hospitals and share of nursing homes controlled by private equity. I won't go through all of these, but these are some of the categories that the private equity stakeholder project is looking at in order to give this rating. Highly recommend you visit that site. Ultimately, who bears the brunt of this kind of corporate capture? Arguably, it's every single one of us. Every single person who interacts with these systems is at risk for bearing the brunt of what this looks like. But the reality is that the heaviest risk will be bared by communities already at risk, people who are already vulnerable, those who are already most in the margins, the sick, the elderly, children, people of color, poor and working people, and low-income households. So many of these communities are already communities that experience worsening health outcomes because of systemic issues and systemic neglect. Some of these, communities are already communities that experience worse police brutality, higher rates of incarceration, right? Like, these are already vulnerable communities here in the state and frankly across the country. But there is, I believe, and I have seen, a growing movement against the corporatization of our country. There is a growing movement against this corporate capture that I hope we join here in New Mexico, because I do believe there is our ability to reclaim our power through organizing and policy change. And that has started to happen. So there are some federal, state, and local opportunities for where we have seen the pushback on the corporate capture happening across the country. At the federal level, folks like Senator Warren are leading on some of these initiatives. On healthcare regulations, there's the Corporate Crimes Against Healthcare Act, the housing market restrictions, there's the Stop Wall Street Landlords Act, and a more general corporate oversight on Stop Wall Street Looting Act. States, as it relates to healthcare specifically, have started organizing around the corporatization of medicine and what it has looked like to put restrictions on private equity in healthcare. In California, for example, there was bills that were passed and signed on the clinical independence and expanding oversight of private equity and hedge funding transactions. In Oregon, the state revised their corporate practice of medicine restrictions, and in Washington, one of the steps they're taking in order to get to those restrictions of corporate practice of medicine, they've established an early framework for a statewide healthcare entity registration. At the local level, municipalities are working on municipal transparency resolutions, community impact assessments, and community benefit agreements, and of course investments in public health infrastructure. As we continue to grow this work and as we continue to build this coalition in New Mexico for corporate accountability, like I said, we've seen some of our partners who are already building legislation around housing, around childcare. We will continue to do the same for healthcare, particularly as it pertains to physician autonomy legislation and really ensuring that private equity isn't making aren't the main deciders behind our healthcare and hospitals, and of course transparency and data collection are incredibly important. But really it's up to us, and I think it's important to have conversations like this that are engaging in material, where we are learning, where we're researching, where we are organizing to ensure that our elected officials understand what is at risk and are acting appropriately. And of course, you have to share our stories. We have to share the stories of the folks who have bared the brunt, the stories of the people who have been mostly impacted by corporate capture, to share your stories, to create spaces like this in order to be able to talk about what it looks like. And of course, to stay engaged and to stay active in this conversation. I, for one, have found it, that rage is a good place to find some clarity. And I think when I think about the corporate capture of our democracy, I can get to rage pretty quickly. So this is my short presentation. I'd love to engage in discussion with you all on all of this and your thoughts on private equity taking over essential services, particularly healthcare. But my question to you first, before we open it up to discussion and questions, is where and how have you seen the corporate capture of your community?
Anybody got an answer to that question before we pick up the cards?
Hi, my name is Johana Williams. I'm a pediatrician in Las Cruces. And so my experience has been that during COVID, when we were busy caring for patients, there were changes in our community. There were changes, of course, in healthcare laws, raising malpractice premiums, and a lot of physicians found that they couldn't be independent anymore. So they needed to come into the corporate model.
Thank you for sharing that.
Anybody else want to?
Connie Chapman, and I have to say, I think part of the problem is we don't know where it's all being done. We've heard the big, awful stories about MMC and other healthcare issues, but what don't we know? Who else is really owning some of the things we deal with? And we don't know why we're getting such bad service, because we don't know the backstory.
Thank you, Connie. There's a great book that I will share with you all. And as I was reading it, it was actually an audiobook because I've been traveling and it's been giving me nightmares. So I have to stop for a little bit. But it's about private equity, and I'm trying to find it here in my little audiobook thing, but I cannot. And things like Dunkin' Donuts, that is owned by private equity, and private equity investors are making millions, if not billions, while employees at Dunkin' Donuts are making minimum wage, wages at the minimum level. So it's pretty pervasive, and I think it's pretty intentional, Connie, what you raise around what we don't know and what we're not allowed to know. Which is why so many states are looking at transparency laws when it comes to private equity in many kinds of industries, but particularly healthcare.
Jana,
Also, this will be the last one since, I'm sorry, you had a process in place.
That's okay.
I want to get back to it.
Well, I was surprised to learn actually today, a little earlier today, that my health insurance company is owned by CVS. I have Aetna, and so CVS owns Aetna, And when they do a prescription, CVS offers, they offer their services to fill prescriptions. I'm encouraged to use CVS. I don't, but I am being encouraged to use it, so they make the profit there. They own the middleman, the broker for prescriptions, and so they take a rake off at every level. And I didn't know that. I thought Aetna was an independent insurance company.
Yeah. There was recently a congressional hearing about this.
Right, and most people wouldn't know that Memorial Medical, which is supposedly a public hospital, is not. It's owned by private equity. I mean, we know because it's been such a disaster here, and a lot of people have raised the alarm. But otherwise, many people out in the community don't know that.
AMR Ambulance Services is owned by private equity.
May I collect any index cards?
Okay, one of the questions is, what kind of legislation do we need?
Yeah, absolutely. I would love for you all to start looking at private equity stakeholder projects. I would love, this was a large overview, which I understand. If you are interested in a policy conversation as we, as SOP and our coalition begin thinking about legislation, I would love to come back to talk about policy work with you all. But like I said, there's been some pretty great legislation, not as fast as we'd like and not as fast and as aggressive as we need, given how aggressive private equity is operating. But there have been a couple of states who've passed and signed good legislation on some of these issues, like California, Oregon, and Washington. But the private equity stakeholder project is tracking all of these policies, many of them which have been attempted and not passed, because of course private equity spends a lot of money to lobby against those kinds of policies.
Another question is, what is safety over profits doing to protect access to healthcare?
Yeah, thank you so much for that question. One of the greatest honors of this work is to talk to people who've been harmed, to sit down with real families and real people who have experienced serious harm. And so much of what I hear from them is, I want to fight for justice for my family, but for other families across the state as well. And so this last legislative session, we also engaged in ensuring and trying to pass legislation that worked at recruiting more healthcare providers here in our state, and we'll continue to do that. I know that the legislature is very much interested in doing more healthcare 2.0 packages that will certainly to support and engage around.
Another one is, you're a counselor. You are aware of a lawsuit between the city and the county with Memorial Medical Center. What are you doing to address current access to cancer care?
I'm here as Mexico Safety Over Profit, and I'm a city councilor. So, but if you have questions about that and want to reach out to me directly through that role, I'd be happy to connect with you on that.
Okay. How informed is our city and county officials, and how can they protect us?
Yeah, that's a great question. I think all over the states, I think there's a bigger attempt at for elected officials to be engaged in format around this. I think a lot of organizations, like I said, like OLE and the Center on Poverty and Safety Over Profit and many other folks are doing the engagement around this. I think the biggest sort of crux that I have seen is, for example, in healthcare and private equity, that legislators have said, well, we can't get rid of it because how else are we going to have healthcare? And perhaps the goal is not to get rid of it, but to build guardrails and to build oversight mechanisms that actually hold these ginormous multi-billion-dollar corporations accountable to our community, and that we are ensuring they're investing back into our community. So I think the work of engaging our elected officials at all levels of government is still really important, and certainly something that I hope this group can engage in.
Christus hospitals are non-for-profit 501c3. Can we get them here? Do we want to?
That's above my pay grade. I mean, look, I think there's our healthcare system is deeply fragile, right? And I think whether it's for-profit or non-for-profit healthcare, I think it is fragile, and it is definitely a lot bigger than private equity, but private equity certainly is not helping in how we attempt to even address our fragile healthcare system. So I don't know that the magic bullet, that the magic solution is a non-profit hospital, but I think that all options are worth looking into.
Anybody else have cards? Isn't safety over profit part of the problem to drive healthcare providers away from New Mexico?
Not since I've been here in September. Certainly haven't done anything that is driving healthcare providers away. Like I said, we are a political home for people who've been harmed. I think there has been so much work that has been done in the last couple of years to silence or even shame people who have been harmed, who have sought justice for their families because someone was severely injured, permanently disabled, killed. And I think those stories are really valid. I don't know when we lost sight of those stories being valid and important in this conversation around healthcare. And for me, as a community organizer and a social worker, that is the main thing that I am doing at Safety Over Profit, and ensuring that we are highlighting those stories, and that when those families are saying, I want to be an advocate for not only myself, but for other families, that we listen and that we make space for people who, in community organizing, we often talk about the people closest to the pain being the people closest to the solution. And we must include those voices and ensure that as a community, we're not silencing or shaming the people who've been harmed, who are trying to tell us, hey, this happened to me and I want it to happen to you. That is my job at Safety Over Profit.
Thank you. My name is Johana. I'm a gastroenterologist in town. Two things. One question for you. The question is, why do you think private equity has such a big foothold, especially in New Mexico? My opinion is it would be just poor governance.
I was going to ask you what you thought, why you thought that.
I think it's poor governance.
Yeah.
But the same people who are government now and all of a sudden say, oh, there's something we have to do about that. It's the same thing that we see now with Project Jupiter. It's poor governance. They say it's money, and all of a sudden everybody falls for that. That's number one. Number two is the safety of profit. I asked the question if safety of profit isn't the problem. And in my opinion, it is a problem. Because yes, you make it sound like a grassroots organization, which it's not.
It is.
No, it's not. It's bankrolled by the Trial Lawyer Association, as you are as well. And that is a problem. Personally, I have to tell you, I'm in the private practice, not employed by any of the PE companies, but I'm on several committees at MMC, and I do exactly that, what you're saying. Trying me to keep our patients safe. And I had to butt heads with administration at times. But I think Safety Over Profit really wants to do what it set out to do, but it's what it puts on its flag. We would work with physicians. It's not what you
I would love to work with physicians. I would love
No,
to.
I'm sorry. You don't.
Okay, so I'm not going to get into this debate
I know.
with you here.
But I just want to say, you don't.
Okay.
That's my opinion.
Okay, well, I would love to, and if you would like to, I'm extending that out to you. If you don't, that's on you. But I would love to. I would love to hear from you. I have learned a lot from certain providers in our community about this. And so I just want to push up to, just because you say it like that confidently doesn't, I'm telling you, I'm the executive director, I've been here since September, and I'm telling you that And I'm not here to speak for trial attorneys, though I have told this to folks in the last couple of years. There's been a lot of talk about trial attorneys and not with trial attorneys. If you want to have a conversation with them, I'm happy to connect you to some of them, and they can come here and talk.
Three-hour-long conversation with Senator Cervantes.
Great.
Yeah,
Well, I'm saying that if you want to have those conversations with those folks, you can. Here's my question. I'm wondering if, and I talk about this to folks all the time. Are you talking about the trial attorneys who are representing people who've been severely disabled, maimed, killed? Are you talking about the trial attorneys who do work representing people who've been brutalized by police? Are you talking about the trial attorneys who right now are supporting immigrants in the immigrant court system or fighting for birthright with the Supreme Court? Are you talking about the trial attorneys who fought for accountability in opioid, with opioid corporations and brought us for, those are the folks we're talking about. I think those are the folks that you should be engaged with. I've been doing this work of social justice and justice work for a very long time, and have often walked alongside attorneys who've been doing the work to support immigrants, to support workers, to support the little guy. And again, that's all I'm going to say about that, because I'm here to talk about safety over profit and the work I'm trying to build with this organization. And if you want to have those conversations, and I urge you to have some conversations and learn from the folks that corporations have brilliantly villainized, I encourage you to, have those conversations with the people who do that work.
How can we support local private companies? Who are they and how do we know?
There you go. Local private companies? I'm not sure I understand the question. Sorry, I just don't understand the question.
But I do want to know, how do we find out who are the private equity owners,
Yeah.
corporate owners in our town?
Yeah,
So that
absolutely.
we can begin to identify who they are, so we can make our choices.
Yeah,
Right.
absolutely. The private equity stakeholder project, highly recommend you visit that. I don't think we have access to the internet, right? I would have pulled it up otherwise, but I highly recommend it. PESP, Private Equity Stakeholder Project, they are tracking all of this, and they have a full list of private equity ownership in our state completely. So, but it's ever changing as well. So that's why we need stronger statewide policies to have regulations on data and
And there is no transparency.
right.
None. We don't know until a business has gone out, or just like you, she found out.
Microphone,
about the
please.
insurance.
Yeah.
I'm sorry, just like you, she found out about CVS and her insurance company, and CVS also owns the facility that makes the medication.
Yeah,
I
that's
mean,
right.
they own it every step of the way.
Right.
I recently found out also that the Peak Behavioral Health Center is also owned by private.
I'm sorry, who?
The Peak Behavioral Health Services.
So I think we all have the same goal. We want to have choices for the patients. And if I read the room correctly, then that means you also would like to have more private physicians or physicians in traditional practices, private practices, not beholden to big corporations. Unfortunately, most of these physicians go away. Our practice is threatened as well by trial lawyers. And when I talk about trial lawyers, trust me, I'm a people of color. I think I support a lot of things that you put on your flag as well. But the reality is, I talk about the trial lawyers that take 40% on people that created a bonanza in this state. This state attracts every trial lawyer from surrounding states. Why is that?
Like I said, Pam, if you want to talk to the trial, I'm not a lawyer, I'm a social worker, I'm a community organizer.
I
If
know,
you
but
want to talk
you're
to
executive director of paid by the Trial Association, I'm sorry.
yes, everyone's heard you say that already.
All right, I just want to
Thank
say
you.
it again.
Yeah.
But I mean, let's come back to the Eshel thing. The Eshel thing was like, how can we keep more private physicians here? What my colleague Dr. Williams said earlier, the pressures are as such that a lot of doctors get priced out. And that has to do with rising medical malpractice, for example. And
I think the next question, I think also perhaps the next
sorry,
conversation
can I just
should
finish
be-
quickly? I'm sorry,
Sure.
can I just finish quickly? I would encourage everybody in this room who has a physician that he trusts, just talk to the physician and ask them these questions. And you will have physicians that are probably employed by hospitals, physicians you still like, but then also ask your physicians that are private practice. And they're very, very few actually in this town, as you know.
Is New Mexico Safety Over Profit working on legislative changes?
Yes.
Do you want to elaborate on any of those changes?
Please do.
Yes, well, definitely, there's a couple of things that we're going to be working on as it relates to private equity in healthcare, like the physician autonomy legislation that was attempted in the past. Looking at a couple other things, I just don't have it that cleared out yet, and I know it's time. We're also working, perhaps, going to start working on legislation around ride-share safety. Uber, for example, who knowingly hires people with history of sexual assault and has put many people, particularly women, at risk, and is, like many corporations, trying to skirt liability for the harm that people experience in their vehicles. So perhaps some legislation around consumer protections when it comes to ride safety apps.
New Mexico Safety Over Profit speaks a lot about harm to patients in healthcare. Do you look at the bad outcomes because people cannot access healthcare here?
I think that if you've decided that that is why, that if there's bad outcomes because of the trial lawyers, or that's what you've decided, I don't know that I'm going to change your mind. It seems like that is what you've decided. For those of you who are like, well, I don't know, I haven't decided, let me pose a little bit different perspective that you should engage with. If private equity is coming in and taking over hospitals, let's say hospitals, and they're cutting costs, they're not hiring enough staff, they're willingly shrinking residency programs, they're not investing in infrastructure. Like if there are serious cost cutting, and not if, that is happening across our hospitals. If these things are happening and we see worsening outcomes, like Harvard Medical School has said, that there are worsening outcomes for people who walk into a private equity owned hospital and they may not walk out, or they may walk out worse than they walked in. I want us to engage in a conversation that says perhaps there's something else there. And the conversation, though, has been so that if you walk in and you are harmed because of systemic failures, because of lack of appropriate staff ratios, appropriate equipment, because you have physicians who have been bad actors in their field, and someone is harmed, and you go and seek justice for your family through the civil court system, which you have a constitutional right to, that's the problem, right? That if you seek justice for your baby who was dropped on its head by the midwife, and then the midwife tried to lie about it, that you're the crazy one and that you're the problem in New Mexico, right? That is often what this conversation has turned into, and I think it's shameful. Ultimately, I hope when you go out and get an attorney, it's probably not for a good thing. You're probably seeking an attorney because something bad happened to you. And often when policy has failed us, when bad governance has failed us, often we can find recourse and justice in the civil courtroom. Both both things should be protected. Our access to healthcare and our access to justice, both should be equally protected for us to have healthy, thriving communities.
Can I say something, because that was my question? The way I look at it, and you know, you're right, accidents do happen. We are not saying that people do not need an attorney when something has gone wrong. And I think most of us that went into healthcare went in to help people. And I have a hard time believing a midwife would intentionally drop a baby. But babies are pretty slippery when they come out of the womb. So there's probably more to that. But anyway, I have found, since I've lived here since 2001, that I pretty much cannot accept new patients because I'm full and we don't have enough pediatricians. And I send my patients to El Paso Children's and the Phoenix Children's and to Denver Children's. We have no care for children, even Albuquerque. They're so busy taking care of Albuquerque, we can't take care of. So what happens to my patients who really take the bus to the office? They're not going to be able to go to Arizona or El Paso or Denver. We need to provide good care here. And I know there are people that have, lots of issues that don't make it to the hospital because we don't have enough here in the state. And when I think about your title of safety over profit, still you're wanting patients to get care. It's not just people that have been harmed by people in my profession, but it's people that can't get to people because we don't have enough here. So that was really.
I don't think we disagree on that at all. Yeah.
If people are concerned about private equity, but are uncomfortable with safety over profits for whatever, personal reasons or other reasons, are there other organizations working on this? Who are other organizations?
Like I said, we're building a coalition on corporate accountability. Right now, we're sort of the only ones engaged on healthcare. Like I said, some of our other colleagues are engaged on private equity in childcare and private equity in housing. But certainly there are growing healthcare coalitions who I hope engage in this conversation as well. And here's one of the last things I'll say about this is that for those of you who know me, there's a couple of you here who know me. I think you know who I am. I think you know my values. I'm not shy about my values. And so I would just ask you to consider why someone like me, who is very a value-centered person, who I'm very clear about my values, would be doing this kind of work. And would I be doing this kind of work for an organization that shouldn't be trusted? Me. If you know me, I want you to think about that and perhaps share that with other people. For those of you who don't know me, some of you in the audience certainly don't like me for my values, for sure. But I think I would just encourage you to come talk to me. And you don't have to be, like I said, I'm not trying to evangelize you into safety over profit. But if you're interested in this conversation and you're somewhat uncomfortable, I encourage you to come talk to me. I don't mind a courageous conversation. I don't mind us talking about this work, and I would welcome it, actually. I would really welcome you setting up a one-to-one with me and us talking a little bit more.
Does your organization have a position regarding the universal health care program that has been considered in the New Mexico legislature?
I haven't read that proposal. Me, as a person who is pretty progressive in my values, I certainly support the creation of universal health care.
Another one was, let's talk about Medicare for all. When will it be? When will it happen?
When will it happen? When we have enough political will, I think, and when we have enough pushback on the corporate capture of our community, because certainly there would be many folks, I think, in New Mexico who would not want to see that happen. And I think it'll take a lot of political will.
How does one contact you with Safety Over Profit? Do you have a website?
Yes, there's a website, and my email is director@nmsop.org. Feel free to email me. And I'm, here based out of Las Cruces, obviously. So please reach out. I really would love to have conversations with you. I think that some of you have made up your minds about us, and that's okay. Like I said, I'm not trying to change it. I would argue that we probably have a lot more in common than not. And I'm not going to be neither shy nor shamed about my belief in people having access to justice and my work with and partnership with trial attorneys who have many clients who have been through pretty traumatizing and awful things, and those clients are now looking to be advocates for themselves and for their neighbors, and that's very real.
What do you think of the Trump health plan? The what? The proposed in the sky, maybe how it's going to be out there, the Trump health plan.
I don't believe that's real, so I'll say that. I don't believe that's real, and given what we have seen in the last couple of years around the ACA and the utter commitment to destruct the ACA, I don't think that there is a real Trump health plan, unless that means figure it out yourself. Rub some dirt on it. I'm sure that's what the Trump
Phil, you're doing another question?
I have a question.
Yeah, that's fine. I just was wondering if there's anybody else with a question.
I have a question. I'm going to write it down.
No, you can ask it. We chose this question method as an opportunity because a lot of people can't hear when they're given a microphone. And then during the presentation, it gave them an opportunity to write down their thoughts as you were presenting. So that's why we decided to do the index card, but then also open it up for regular questions. And Phil is excellent on the mic, so he knows how to do it.
And I just wanted to say, did you see that demonstration of great mic work? You have it right up to your lips, just about, to be heard. Thank you. So my question is pertaining to, I know that you are talking about private equity taking over corporations, and specifically you were talking about the medical field. But I kind of want to know what the purpose of your presentation is, because that's kind of a given for me, that I know that that's happening. I mean, I feel it because it's not just the medical field, but it's industries in general. What is your purpose with your presentation this evening? And if you're asking for that we be aware that that's part of your purpose, which I'm assuming it is, but what's our involvement? How would you like for us to be involved?
Thank you.
If
Great
we
question.
need to be involved.
Absolutely. Great question. I think one of the purposes was to have a basic foundation for a lot of us. You might be very aware. I don't know that everyone else is. So I think it's like a basic understanding of this is happening in our community. But your other question is a great question. And if you're not scared of me or this organization, I would recommend you reach out. But if you don't want to, as Indivisible, and I'm sure you're part of other organizing efforts across the community, that you're having conversations with your structures of organizing to talk about the stories from our community and how people have been impacted by private equity. Start talking to legislators about their plans for regulation and oversight of private equity, and start engaging in policy conversations at all levels, at the local, at the state, and at the federal level. I would argue, obviously, state and local are the most important and where you will have the most impact. But I hope that there is an opportunity for storytelling and for you to share your story and your concern, and to start organizing amongst yourselves on policy opportunities for oversight and setting up guardrails. And again, it doesn't have to be healthcare. Like, if you're someone who is, passionate about housing, that is happening not so much in Johana County, but like Bernalillo County is experiencing a ton of additional barriers to housing security because private equity is coming in and buying up a lot of homes, buying up a lot of apartment complexes, buying up mobile home parks, which are a huge entry to homeownership for many New Mexicans. Private equity will come buy it. You'll start seeing that things are not taken care of as they were once, and like conditions deteriorate. It's the same model, frankly, everywhere, and the same devastating impact. So even if it was, if you want to engage in something on private equity outside of healthcare, those are opportunities as well.
The other thing I wanted to bring up is the fact that I think there's two different things happening this evening from my perspective, sitting back here. I'm listening to your presentation, as well as I'm listening to medical providers who are here this evening, and it sounds like it's two different things. I understand your perspective, but I also understand their perspective. Before I can think about private equity and what's happening here in the medical field, my concern is with not having enough providers here, that there's a shortage of providers here, and we can't retain them. And I think that's the next step that has to be had in a conversation, in a forum such as this, is to talk with medical providers and also talk with, maybe have a panel discussion. So, but I think there's two different things going on here. And I understand your perspective, but I also understand a doctor's perspective as well.
I think yes, absolutely right. I think what I want to encourage us is that if there is this desire to only talk about provider shortage in the capacity of medical malpractice, I think we are doing a disservice to our entire community, and I don't think we are seeing the full picture of what it takes to have a more thriving healthcare system in our community. And that is all I'm hoping to present here, so that we can engage in more meaningful conversation about what it will take.
Thank you. And I also want to say I'm also Vice President of the Johana County Medical Society, and Dr. Williams is also a board member. We'd be more than happy to have a discussion. And the only thing is, it's not that I don't like you. I mean, you put this on me that I don't like you.
No, that wasn't coming right.
I don't know you really. But I have a problem with safety over profit, an organization that had been sued by the ethics committee, in order to divulge actually who's behind it.
Yeah.
They tried everything.
So here's the thing, right? I understand that you have an agenda here to make sure that people know
I don't have an agenda.
which is okay.
Transparency, but let me
Yeah.
finish, and then you can finish, because you talk a lot.
I do,
and we
because
barely
I
get
was
much.
invited here to present.
I know, but
Yeah.
you talking over me. You talking over me. I mean that is a problem, and that's for transparency. I want you to give that, and I think what we have in common, if you're sincere, is I went to medical school. I had 17 years of training. My job is to help people. Like, I'm not a bad actor that came here. I'm not a bad actor. My job is actually really to just help patients. You know, that's what it is. And I take a little issue with an organization that puts on their flag that's like, oh, we're here to help patients. I'm all for it. As I told you, for 11 years I'm on the committee. It's a peer review committee to really find out the bad apples and make it safer for patients. Because I have a problem with that when someone puts it on their flag and then behind it is actually more money that people want to make. You know? And that is in the same way as bad as private equity. That's all I want to say.
Sorry for interrupting you. I also take offense to the very clear sort of intention here to come and make sure everybody here takes away a different perspective, or to continue to say, don't trust this organization, from folks that, frankly, I feel like I have been a trusted member of this community for a long time, because people, again, know the work that I've done in organizing in advocacy spaces. I've been the executive director since September. When I took this role, I knew the issues that this organization has had, and I could have not taken it. I could have not taken it, and I still did because I believe in the work. And the issues that you're raising, you can find those issues since I took the position. And so I find it somewhat disingenuous to say that you know exactly who we are when you and I have never met and we've never talked about the vision of this organization. And I am here to tell you pretty genuinely and frankly that my vision for this organization is to organize with directly impacted people. And I understand that when I talk about someone who I sat with and they've shared their story with me, and then I say it in this space, and the doctor said, well, I don't know if that's true,
But
right? Like, I don't know.
have you been sued by the ethics committee, yes or no?
Me? No.
No, the
The organization? Yes. I don't, this is, okay.
This is not, we're not getting into that.
No, because this is very clear.
That's all.
But that's not the debate we're trying to get into. The question
No,
was-
but we understand why this debate continues to happen and why people want to continue to happen. I think there's a I think we should all question the desire to villainize the folks who have, who are fighting for people to have access to justice when harm has occurred. And has this organization stumbled in the past? Totally, absolutely. And since I came on board, I am ensuring that this organization grows with integrity and commitment to people who have been harmed. Because people have been harmed, correct? Correct, that people have experienced medical malpractice, that people have been disabled, people have been killed. That has happened, right? And so those folks deserve, and not even deserve, but many of those folks are desiring a place at the table to talk about advocacy and to talk about how to shift a system that harmed them, much like you are. And I would welcome the opportunity to have that discussion. It doesn't seem like with you particularly that might happen. You've made up your mind about us. I hope that with other folks here, if you have not, that you come talk to me. Just, if this discussion that, you know, we talked about before, perhaps was mentally prepared for it to devolve into this. But if you're interested in the corporate capture of our community, if you're interested in what this means for all of us, I would welcome an opportunity to have a conversation with you.
Okay, well, on that note, it's 7 o'clock, and I think Johana has been very, very open and answering all the different types of questions you've had. She's offered to have you contact her and talk to her, email through, you know, your website and stuff like that, so you can take her up on that. So with that, I say thank you very much for your time.
Thank you.